Sulma Arias here. I am representing a network called People's Action. We are a national network of grassroots power building organizations in 30 states across the country. And we represent over 1 million leaders in both urban, rural, and suburban areas of the country. And our mission is really to build the power of working class people, poor people in all of these areas in the country. And we bring about change by engaging people in issue campaigns and in elections. And we think it's so important for the Latino community to be aware of the dangers of Project 2025, because it really stands against everything we believe in and organize for, which is a country and a future where people's basic needs are public goods, a place where people of all genders, races, and backgrounds can thrive. And Project 2025 is the total opposite of that. So Project 2025 is an agenda designed really to attack, to divide, and to control poor and working class people in order to enrich people like Trump and his billionaire friends and the greedy corporations. And that's just what it is. And let's call it for what it is. And like some of my colleagues here have said, it would disproportionately impact Latino communities because it threatens Medicaid coverage. It increases the cost for older Latinos, especially, by raising the cost of prescription medication. It would worsen healthcare outcomes for Latinos by blocking them for accessing reproductive health. Instead, Project 2025 proposes to allow the government to monitor people's pregnancies, to potentially prosecute them if they miscarry, and also would allow employers to deny workers access to birth control. In other words, Project 2025 rejects abortion as healthcare. It reverses the FDA's approval of the abortion pill and requires states to report abortions to the federal government. It actually redirects Title X family planning funding towards education about abstinence and marriage. So we know that Latinos make up nearly 30% of all individuals covered by Medicaid. That includes 4 Latinas, so 1 out of 4 Latinas who are covered by Medicare. Project 2025 would say, like someone has said earlier, targeted time limits or lifetime caps. It would also end Medicare's ability to negotiate for lower prescription prices. And that is so dangerous. I mean, in challenging their ability to negotiate for lower prescription drug prices really targets our communities, our Latino communities, especially because we know there is a higher likelihood of experiencing drug affordability challenges. And we know that Latinos are more likely to undertake or not take needed prescriptions due to the prohibitive cost in prescription medication, especially for chronic conditions. So what we see here is that the ones who tend to benefit from implementing Project 2025 measures would be corporations like United Health Group, that what it would do is it would accelerate the privatization of Medicare because it would make Medicare Advantage the default option for those enrolling in Medicare. Medicare Advantage is a privatized version of Medicare that increases costs while failing to deliver the care that people really need. And lastly, I want to say that the solution to creating a more equitable healthcare system is for Congress to enact improved Medicare for all. That action will shift power from the greedy corporations like United Health Corporation and the ultra-rich towards control of healthcare, people controlling and public control of healthcare resources. So we here at People's Action, what we're doing to go against Project 2025 and to ensure that those policies and ideas don't get implemented is that we are training over 43,000 volunteers. We're having conversations with over 600,000 people about the dangers and about the opportunity that we have in this upcoming election to build together the future that we need where we all can thrive.